So good morning again, everyone. I'm Dwayne Spencer, President and CEO of Habitat for Humanity of Greater Memphis. And today is the conclusion of our Health and Housing Summit. And I want to again thank you all for being a part of it. Thank you to the Tennessee the Tennessee Housing Development Agency, Wells Fargo, and Methodist LeBonner Healthcare for helping support this event and making it possible, as well as our advisory planning committee. So I want to remind you of the original intent of this summit. So our goal was to bring together sector experts to help us tell the bigger story around health and housing connectivity, especially pertaining to older adults. There were 7,000 seniors in our area alone who needed home repairs and improved accessibility and mobility when we launched our program. We've since served over 1,000 older homeowners, but thousands of seniors remain in need of help here in Memphis, across Tennessee, and even more across the country. Many of our older neighbors desperately need home repairs and retrofits to remain at home safely. And for our clients, they simply cannot afford these repairs on their own. Dr. Tiffany Manuel's presentation yesterday really struck me as I prepared my thoughts for today. She reminded me that we already have a proven solution, a program that we know has an impact that goes far beyond the clients we serve. To date, our total local aging in place investment is more than $8 million. The cumulative projected benefit from improving the housing conditions of just 500 seniors. Remember, we've done more than 1,000, but from just 500, the cumulative benefit is more than $26 million. That's 3.3 times the initial investment. Those benefits include things such as long-term care savings, medical cost savings like fall prevention, utility bill savings for the senior, and increased home values. If ramps and grab bars help older homeowners remain stable and physically safe in their homes, they'll fall less and hospitals will save. By 2019, we were able to save hospitals an estimated $1 million in fall-related emergency department costs. Each year, critical repairs and accessibility modifications by our Habitat affiliate prevents an average of 22 seniors from going into a nursing home prematurely and leaving their home vacant. This equates to $2.2 million in savings in taxpayer dollars to house seniors in nursing homes. These repairs not only help the AIP clients stay in their homes safely, they also help improve property values around those homes. Memphis Habitat AIP clients and repairs provided a $17.7 million positive spillover into neighborhoods by improving aging in place property value and remediating structural blight. The program also saved city and county governments $11.7 million on code enforcement, police, waste management, and fire department calls by preventing property values and abating preventing vacancies. And so by focusing on seniors and their homes, we're providing $29.4 million in savings just right here in Memphis and Shelby County. So we're helping seniors age in their homes and community, but we're also helping our city thrive. So where do we go from here? I haven't shared Memphis Habitat's big goal yet, but I'll be excited to do that at the end of the session today. So I want to go ahead and get you guys into the panel with our moderator and our special guests. So today's moderator is our friend and colleague, Alyia Gaskins, Senior Program Officer at the Melville Charitable Trust. Alyia's work primarily focuses on housing affordability and stability as key components of preventing and ending homelessness for Black, Indigenous, and people of color. A public health strategist and urban planner, Alyia has over 10 years of experience developing and executing large-scale initiatives and partnerships. Previously, she served as Assistant Director for Networks and Programs, focusing on health at the Center for Community Investment. In that role, she led accelerating investments for healthy communities, which helps hospitals and health systems invest in affordable housing. Alyia has also held positions with the National League of Cities, which is where Paul and I first met her, also at DC Hunger Solutions. And she founded Cities RX, a consulting firm focused on advancing innovative models of cross-sector partnerships. Alyia, I'll turn it over to you.
Okay, good afternoon, everyone, and thank you, Dwayne. I am really excited to be here with you for this important discussion. Just to tell you a little bit about the perspective I bring and why conversations like this really speak to my heart. So my mom has asthma and diabetes. She also has one lung, sarcoidosis, and a number of other health complications. And I can remember when I was younger, there were times when we would go to the hospital, sometimes 10, 12 times a year. And I can remember, waiting as we sat there waiting for the paramedics to come. I can remember riding in the back of the ambulance with her, going out of the emergency room, always with this question in mind of what would it take to help my mom be healthy. And as I got older and started just understanding more about the challenges my family faced, I watched my mom work 2, sometimes 3 jobs, yet still struggle to make ends meet. There were times when she was making, the difficult trade-off between how do we pay the mortgage, how do we purchase her medications, or how does she put food on the table? And I think it really ingrained in for me that health and housing are not just words. They are things and decisions that people are trying to navigate every single day. And so I'm excited to hear about the solutions that Memphis Habitat is advancing, but also to hear from our panel today, what are ways that we can go deeper? What are the things we need to do to accelerate our work so that no family has to struggle in the way that my family did, or in the way that so many others are struggling, especially in the wake of COVID, as we think about the health and economic impacts of this pandemic. And so I'm joined here today by a really fabulous panel. I'm going to invite them to turn on their cameras. I'm not going to read their full bios. I'm just going to give you a little teaser, but would encourage you to go back to the Summit website so that you can really read their full story and learn about the expertise and perspectives that they bring to the conversation. So first, we're joined by Dr. Cy Huffman, who is an internal medicine physician and serves as the Chief Population Health Officer for BlueCross BlueShield of Tennessee. In this role, he provides clinical and strategic leadership to both internal processes as well as essential community-based partnerships for improving healthcare, care, and healthcare costs for Blue Care members. So welcome, Dr. Huffman. We're also joined by Jeremy Heidt, who is the Director of Industry and Governmental Affairs at the Tennessee Housing Development Agency. Here, Jeremy leads an 11-person division that is responsible for strengthening THDA's relationships with industry partners, including housing nonprofits, public entities, other programs, and working with elected officials and other government agencies across the state. Welcome, Jeremy. And next, we are joined by Dr. Jan Young. Dr. Young is the Executive Director of the Assisi Foundation of Memphis. And the foundation's mission is to respond to the diverse needs of the Memphis community and to support health, lifelong learning, social justice, and the responsible use of resources with respect and compassion for all. Welcome, Dr. Young. And last but not least, we are joined by Paul Young. And Paul is the Director of the City of Memphis Division of Housing and Community Development, HCD. And HCD is responsible for coordinating both community and economic development projects throughout the city. Welcome, Paul. All right. So with that, I really want to dive in and have us get started. You heard from Dwayne that the purpose of this summit was to bring together sector experts. And so for those of you who have been following the summit from the beginning, you've heard from, partners in healthcare and community development and philanthropy and government. You've got a taste of what they bring to this work. And so I want to just start by level setting for maybe those who have not been on this journey with us. And so I'm going to ask each panelist just to quickly share the sector you represent, and then share one word that you believe represents or summarizes the role that your sector is positioned to play in advancing health and housing solutions. And Dr. Huffman, I'm going to start with you.
Thank you. So I represent what might have been labeled insurers. We preferred to be called health plans. For the purpose of this discussion, maybe more specifically, Medicare Advantage plans that are really tailored for seniors. And there are some plans that I work with that even more specifically address low-income seniors and other vulnerable populations. So I'd say the one thing that we and I feel compelled to contribute is leadership.
Thank you. Paul, let's hear from you next.
So I would say the sector that I kind of represent two sectors. One would be government, obviously, and then the other sector is housing. And the one word that I believe represents the housing sector specifically would be stabilization, because I believe that housing is a stabilizing factor for individuals and families.
Great. And Jeremy?
Morning, everyone. I represent the state government side, specifically the Housing Finance Agency for the state. Our role is to try and facilitate some of the work that a lot of our partners are doing through financing and through some of the federal programs that we administer on behalf of the state.
Great. And Dr. Young?
Hi, like Paul, I guess I represent two sectors. One would be, at least according to my birth certificate and most of you, in the aging population and a senior citizen. I prefer to think of myself as chronologically gifted, thank you. But for the purposes of this panel, I represent, I'm honored to do so as well, philanthropy. And our word would be leverage.
I love that. It's exciting to hear about the different ways that our sectors can come together and bring, as you guys said, leadership, stabilization, financing, and leverage. I think at the same time, we know that not every health plan is entering this work in the same way or for the same reason, in the same way that not every government agency or philanthropic organization is. And so I'm curious if you could speak to a little bit about what you've seen as the motivations or the drivers for why your sector is engaging in health and housing initiatives at this time. And also, what do you think it would take to maybe get more organizations or entities from your sector on board? And Dr. Young, I'm going to start with you this time.
Okay, I love the way that Dr. G framed it yesterday when she said, we've got to connect with the why and the so what and the collective we. And so making the case for support from the perspective of the collective we and how it affects all of us is so important in order to mobilize everybody's support. If we're all lucky enough to be able to continue to age, we are establishing the foundation for how everyone will thrive in the future.
I think that's a great point, the so what and the why. I'd love to go to you, Dr. Huffman, and get your thoughts on this particular question. What are the why for why health plans are getting engaged at this moment?
Well, this may sound like a cold answer, but we have to be, realistic how things really are. And I think the good news is that we're responding to the governmental lead for Medicare and Medicaid. back in 2010, a fellow named Dr. Don Berwick received an interim appointment as administrator of the Center for Medicare and Medicaid Services in America by President Obama. He was there just less than 18 months, but really set a new course, a new framework, a new strategy for Medicare and Medicaid services in America called the Triple Aim. Many of you are familiar with that. And that focus has continued. So we contract directly with Medicare for Medicare Advantage, work. So we contract with the government to coordinate clinical and social supports for our members. The clinicians call them patients, other people call them persons, and we call them members. So we have, thankfully, a contractual obligation to deliver on better quality care, better patient outcomes, and we're called upon to do that efficiently at a lower total cost per capita or cost per person. So the triple aim is really better care with people achieving better health, and we do so efficiently. That's our challenge. And you hear the term accountable care organizations. We're an accountable care organization by design now from the governmental structure and expectations. So that's been the most helpful thing of all. If that had not occurred, I wouldn't have my current job, okay, as Chief Population Health Officer. It is all about population health now, and that's all about improving health and well-being and doing so efficiently. I like to remind myself from time to time as the work gets hard. There's a fellow in Denmark who's a health and social innovator, and that Dr. Berwick introduced me to, and a while back, and he said, look, we must deliver on the social mission efficiently. I'm like, wow, I'm going to remember that. So that's really the motivation. Thankfully, we have that drive from the people we're accountable to, primarily, that being the government, but we have a heartfelt commitment to our members as well.
Yeah, I love delivering on the social mission. And I think the other thing that really comes through loud and clear for me is the opportunity for cost savings and how we efficient stewards of resources. And then also thinking about the ways in which, you talked about Dr. Berwick coming to his new position and what he was able to bring forth. But a lot of times, policy and system changes are drivers that really shift how our sectors show up in this work, why we show up, and the resources we have available to distribute. Jeremy, I want to turn to you next, because working at the state, you get to work with so many different partners and agencies. I guess from a state perspective, why is it important for your agency to be engaged in this work and cultivating partnerships related to health and housing?
One of the things that I think is so important is you can be an expert in one thing, but you're not an expert in everything. So in order to do something creative and innovative and worthwhile, it takes a bigger partnership. You've got to have other people who can come in and go, we're noticing this, particularly the healthcare folks. They're noticing the number of people like coming into the emergency room with chronic conditions, things that are related to how they're living, where they're living, and the situations they find themselves in. And then we're looking at it they're going, how do we help the housing situation? We're not housers, we do medicine. So bringing us into the conversation, I've met with folks at Erlanger Hospital in East Tennessee, Le Bonheur in Memphis. And just recently we started a nursing innovations grant. We went after a large national grant and we won it. It's a partnership with the Department of Health in Tennessee, the Department of Health in Arkansas, the Tennessee Housing Development Agency, and we're calling it the Tri-State Innovation Fund, basically to train nurses, bring in the health professionals and get them up to speed on some of the housing issues and help get them involved in housing at the local level, at the boards, the zoning boards, the planning commissions, so that their voice on health issues is heard at that level, so that it can affect those things like policy and drive those decisions with an informed understanding of what's at stake. It's not just about housing, it's about all the other ancillary benefits. And if we don't bring all those voices together, it sounds like one person shouting in the woods. If you have a whole chorus, suddenly it's something that they have to pay attention to.
Yeah, I think you're exactly right that these issues are so interconnected, and one solution by one sector is not going to solve them. And so how are we pulling upon each of our strengths? And it reminds me, I think I'd shared this with you guys as we were preparing, but there's this quote that I often reflect on by a woman who I've had the pleasure to work with. Her name is Allison Albee, and she's the co-founder of Groundworks Consulting. And something she said is that, in our current moment, so right now in this, navigating this pandemic, navigating the situation where there are significant health and housing inequities and just other challenges our country's facing, she talks about how we must summon the courage and endurance to dismantle systems that uphold interlocking injustices while restructuring systems that honor interdependence and ensure belonging. And Paul, I want to go to you next because you have this purview from your department in Memphis where you get to look at how do we design and plan a city? How do all of these things work together and these systems interact in order to, in some ways improve outcomes, but as we know, they don't always improve outcomes for everyone. So can you talk a little bit about how Memphis is trying to approach health and housing more, comprehensively, and any specific interventions for older adults?
Yeah, so thanks for that question. When I think about our role when it comes to this space, from a local government in general, our goal is to provide basic services and improve the quality of life for our residents. And I view, and many of my colleagues in local government view, housing as a basic human right. This is a right that all people should be afforded to. We want to advance opportunities for the people in our community. And in order to do that, people have to have a safe, stable place that they can call home. Oftentimes, we look at the challenges that we have in Memphis and we talk about affordable housing. And when we talk about affordable housing, oftentimes we're thinking about the dollar amount that you pay for your rent. But when I think about affordable housing, I'm thinking about quality affordable housing and quality housing across the board. And one of our greatest challenges in this community is that we have a high number of housing units that are in a severe state of disrepair. Many of our older residents are living in those housing units, and some of those older residents are taking care of next generations of kids. And so you have older adults and kids that are growing up in housing units that are in a severe state of disrepair. And so it's incumbent upon us as a local government to try to identify ways to address that with nonprofit partners like Habitat and programs like the Aging in Place program that Habitat has put in place for the last couple of years. They've been able to go in and make renovations to homes, but we need to take it to a higher level. During this pandemic, obviously, we've put a lot of effort into trying to address the immediate concerns of getting rent paid and getting utilities paid. And one of the things we've been pressed upon figure out how we our foot off the gas and the other issues that have been us for many years, which would be that quality of the housing stock. So trying to figure out how we can do more. Some instances, we want to still try to figure out how we can do more to help our residents.
Yeah, I feel like if there was ever a time to figure out a new way of working or new ways of doing this work, it's now, as so many of us have had to just figure out how to shift to our new normal, how to figure out new ways of reaching people during the pandemic. And so I'd love to spend a little time there for a second. I'm curious, Paul, let's start with you and then we'll kind of bounce around. But what ways specifically have you guys had to shift and adjust to better meet the needs, the health and housing needs of residents in Memphis?
So we've made a lot of adjustments over the past year, quite frankly, and a lot of our issues have been around that emergency need for housing. So we've done some things where we've helped some of our homeless brothers and sisters get hotel rooms and have them lodged in different spaces. We've worked with groups like United Housing, which is another nonprofit partner in our community, to establish programs where we're able to pay rent and mortgage through some of our federal funds. We've also established an eviction program where we worked with Neighborhood Preservation Inc. and a host of other partners to provide legal assistance to folks that are facing evictions. So a lot of that has been a part of our emergency response. What I think we haven't done so well is address the physical conditions of housing in many of our communities. And so our goal over this next year in 2021 is to try to really put some more dollars behind that. If anybody, for our Memphis people that are on, you may have seen the mayor's Accelerate Memphis plan, where he had a plan to invest $200 million into our neighborhoods, where 7.5 million of that will go directly towards affordable housing. And we're still working out how much of that will go towards home repair specifically. So I believe that initiatives like that will have a dramatic impact because that 7.5 million is a lot more than we've ever had dedicated from our local budget. Most of the time we use federal funding to address housing needs in our community. And now we're starting to double down on how we as Memphians can determine our own destiny and how can we allocate dollars to go into the programs like this.
Yeah. I feel like sometimes it feels there's never enough, doesn't always feel like we always have the resources we need to meet the scale of the problem. And Dr. Young, I'd like to turn to you next, because this is often a role that I've seen, especially being in philanthropy, that we sometimes are figuring out how we can step into the gap and really, as you spoke to at the beginning, put our resources in ways that leverage opportunities and leverage these connections and partnerships in order to help resources go further. So if you could speak to a little bit about the ways in which either your foundation or you've seen the sector as a whole shifting and creating new ways of working to better deploy resources to address these issues.
Sometimes I don't think we do enough shifting, and sometimes I think our shifting might be misdirected because we shouldn't be telling the sector what to do. We should be listening more before we leverage our dollars. And obviously we know that when we're talking about resources, we're talking about more than just money. The reason I love working with Paul Young and his team is because first, Paul thinks like an anthropologist. So given that, he's already thinking more broadly. Also, government is so limited and they can and can't do. I believe that's a role for philanthropy to spend with resources other than money, such as institutions, inviting other sectors to really think about the issue in a different way, providing expertise from other sectors as well, in order to look at a issue differently, perhaps. And so philanthropy can do things like the COVID response fund that our community foundation did a fabulous job leading with, but we know that's not enough. Emergency stopgap measures aren't going to take Memphis to what used to be called the place of good abode. I understand at one time it's had a sign, and then, you know, welcome to Memphis, a place of good abode. And ultimately, that's all we're talking about, right? Being a community of good abode.
You know, your remarks really hit home for me, because I think it's also true sometimes as philanthropists, what do we need to do to listen more intently and actively so that we can get out of the way? What are the ways that we can structure our processes, our grants, and, you know, just our ways of convening and leveraging all of our assets so that we're not in the way, but actually we're making it easier for people on the ground to do the work that is reaching the people we're all out to benefit.
And may I add one more thing, Alyia?
Please.
You know, when we look at all the registered nonprofits, at least for Memphis and Shelby County, and I apologize that I don't have the stats for everybody on the call. If we look at the total amount of expenses in a given year for all of our registered nonprofits in Memphis and Shelby County, and then we look at the asset side of every single local foundation, we deplete the entire account of all of our philanthropic organizations and not meet the total expenses of all of our registered nonprofits. So we've got to get out there with more than money.
Mhm. Jeremy, I want to come to you next because I know that you are looking at some creative ways, not just through partnerships, but also looking at ways that for the resources we do have, how do we use them more strategically? How do we braid and blend and pull together different programs to try and better address some of the challenges we're facing? So I'd love to get your perspective on the dialogue so far.
And I absolutely agree with Dr. Young. Sometimes there are handicaps on some of the programs we can do with it, what they can be used for, what challenges, what things we're allowed to do, what we can't do. So trying to find a nonprofit partner that can plug in and fill some of those gaps is really important. I know from our standpoint, the programs that we administer at the federal level, again, the need outstrips the available resources in every single case. Even with the rental assistance that's coming, that's a fairly large chunk of money. It's more than we've probably seen in a lot of programs at one time, but it still doesn't meet the need that was in the community as far as people who've been behind on rent and are at risk of losing their housing. There's a lot of challenges. And I think one of the things that we've tried to do is look at those programs structurally and figure out ways that we can build them to where they nest together or dovetail in a better way, because we find that things like the Heidt program for low-income heating and energy programs, the weatherization programs, our trust fund grant program at the state, they can do certain things, but they can't do other things. So we try and layer those structures together so that we can do all the repairs. Like Paul said, you can't go in and just fix a roof in a house that doesn't have any heating. You can't go in and fix the heating if there's actually no foundation under the house. That's, it's going to fall in on itself. It's a real struggle to try and find ways to build those bridges together with the financing. Even with us, we've put $73 million out since 2006 through our Housing Trust Fund program. That's money that's generated solely by our agency from our primary core business of mortgages, and we invest that back into the communities to help local governments and nonprofits. We've also structured some of the federal programs that we have some control over, like the low-income housing tax credits, where we've put an innovation round into there, trying to find ways that are unique or groups that are trying to branch out and do something different. So we have opportunities for groups, but we really need that leadership at the local level to step up and say, this is a need we've identified and this is a solution we want to provide. And if it fits inside one of the programs that we can help fund, we will help them. It's just the challenge is we can't come up with all the ideas, and we still need somebody on the ground to run and execute those.
Yeah, and I think you raise a good point that also, having the data to be that targeted. So do the folks on the ground have the data and the capacity to be able to target and identify where resources need to go most? And so, Dr. Huffman, I want to bring you in on this question because I know that your health plan is doing some really interesting work around like data analysis to identify where to direct resources to. And it'd be great if you could speak to that work, but also what lessons might we be able to take away to help our local partners be able to think about the data they're collecting, how it's being used, and how that can be used to really lay the foundation for where we direct our limited and constrained resources to.
Yeah, first of all, health insurers, health plans are often described as having big data, and we do. And in terms of partnership, what we can bring to the table in terms of what's really going on with the people that we insure or support. That's actually very helpful when you're trying to work on building the case, for investment and improvement as it relates to health. So we have big data. One of the things I'm most, gratified by, I guess, started about 5 years ago. Our organization took our best and brightest people in information technology and information, delivery, and all the experts at BlueCross BlueShield in Tennessee, and they helped us build a social vulnerability index, which is modeled after the CDC, social vulnerability index. And so what that has allowed us to do is really understand the pressure points and the challenges and the struggles of every single member we insure. It's a lot of people in Tennessee. And we know it by person. We're able to modify that not only by looking at some of the same data that all of you might be looking at and gathering that and putting in our engine, but we also ask our members. You know, we make an assessment when we talk to them. Every single time we talk to them, we ask them how things going, and in a structured way, we ask them in certain certain buckets. Are you struggling most here or there, and what do you most want support for? So we know that honestly, it's not perfect, but it's pretty amazing at this point for every single person we insure in Tennessee. And then we know it by region. We know our practice partners in primary care and behavioral health care in the community, the members that see those clinics. We know a profile of every practice in Tennessee now about kind of, if they're going to try to design better medical care and holistic care, you know, how do we help them? Well, we start with that data, right? And so we're trying to figure out how to, you know, improve health outcomes, and obviously addressing social needs. And some people call it social care. You know, it's not just medical care. You got to have social care. So all the stuff everybody talks about, we actually have data to inform those discussions. So we're ready, you know, to talk at a community level or a statewide level about how we can make a contribution. Whoever is already concerned and committed, they can pretty much consider us the same way. You know, that's really where we are. We're not all knowledgeable, however. When I heard, you know, Jeremy talk and Paul, you know, others, it's like, you know, that's stuff I always wanted to know, right? How do you pull this stuff off? How do you bring people who really want to help, but they have no idea how to help together? And I have to do this shout out for Habitat for Humanity, and you know, I just can't restrain myself. That's the genius of Habitat for Humanity. Is anybody, regardless of the color of their skin or age or whatever, can come and say, look, I want to help, show me how. And they can actually see what's going on. And, you know, I live on Lookout Mountain, Tennessee. It was in Dr. King's speech, I Have a Dream speech. He had a dream that everybody from Lookout Mountain, Tennessee, to Stone Mountain, Georgia, to the streets of Birmingham, you know, could all do better. So anyway, I'm rambling profusely, but I just want to tell you that we can bring really important information to the table. And, you know, that's probably the best thing to contribute at this point.
Yeah. No, and I want to get Paul and Jeremy in this conversation, because you said directly you want to talk at the local and state level. And so I'd love to hear from the two of you, as partners like Dr. Huffman and others from healthcare look to engage and want to be in conversation and dialogue with your sectors and your work. What do they need to know, and what are the spaces we have to facilitate more of that engagement and conversation? And Jeremy, why don't we start with you, and then Paul will go to you next.
One of the best resources that I can point to as a place for like-minded folks to get together is the Tennessee Affordable Housing Coalition. We're one of the few states that has a true statewide coalition. There are also regional groups that are together. I sit on the board as an ex officio member. I saw one of the executive directors of the coalition was actually in the chat earlier. Hi, Patricia. And they just hired a new executive director. So it's a good place, it's a growing place, and it's one of those spots where, you know, you bring the right people together, and they may have different needs or different wants, but they're all in there because they want to see affordable housing. And if they bring the right attitude, you can find partners to do a lot of things. So that's one of the things I would pitch as a place to go. The other thing, I think Paul's probably got some local groups and some local mentions he might want to throw out.
Yeah. Paul,
Yeah,
before I go to you really quick, just
go
a
ahead.
quick follow-up, Jeremy. You talked about some of the work that the coalition's doing. what's the pitch? Like what's needed to take the work to the next level and to move on some of the ideas that are maybe coming up in the coalition's conversations?
I think it goes back again to that passion at the local level. You've got to have buy-in from not just as much as I might want to see change and things happen in the state. It's the local level that drives most of the decisions on housing. It's the local zoning board, it's the local planning commission, it's the local planners at local government. They have the greatest impact. The things the state can do is maybe help streamline things or maybe get out of the way in some cases, but it really has to start from that local perspective first, because without that, we can't force housing down into a community. It just won't work.
All right, Paul, bring us local.
All right, so locally, I would say, one great space to tap in would be the Healthy Homes Partnership, which LaBonner, our local children's hospital, coordinates in partnership with Green and Healthy Homes Initiative, the health department, Habitat, and many other agencies participate with that group. And to drill down to the point that you made, Alyia, what specifically could be helped with through that collection of agencies. We've done pilots where we have actually done various interventions on homes to see how, if you are able to remove carpet and some of the air handling units and some of the things that are contributing to poor indoor air quality, are you able to maximize health benefits for the residents in those units? We'd love to see more opportunities like that. How can we show on a larger scale that if we're able to make these interventions, that you can have health benefits? And ultimately, at least my personal goal is to see one day when an elderly resident or a child comes into an ER, or they're a recurring visitor to their doctor's office for a specific issue, that doctor will ultimately be able to write a prescription for a housing intervention. That insurance funds can also help to cover some of the things that we know are contributing to the poor health outcomes that many of our families are suffering with.
Oh, I love that idea. Dr. Huffman, I'm curious your thoughts about the housing prescription.
I love it. There's some of you probably know the story about health leads, and that started up at students at Harvard, and they started shadowing. They wanted to go to medical school, so they started going to some of the safety net health clinics in Boston, and so they launched this idea of actually writing a prescription. It's usually doctors, but nurses, whatever, they'd write a prescription for social services, and the students would go figure out how to get them met. And that's a whole national movement and organization now. So I think, Paul, what you shared is marvelous. And that's really, honestly, what we found with working with primary care practices and behavioral health providers, community-based across the state, is they are so busy, and they don't know this stuff. They're not, some of them have social workers on their team, most of them don't. They're like, yeah, I want to help, but I don't know how. So that idea of them, that's how we're kind of approaching them now as a health plan. We're like, well, we're not going to expect you, that you have to do all of that. That's where we fit in with the health plan. It will help make these community connections, try to understand what exists in the community, and what are both the, not just really the capacity too. I mean, if you don't have any housing vouchers, you don't have anything else, it's like, the people trying to help, they're like, well, why am I even asking them about that? I can't do anything about it. That doesn't go over well with doctors, okay? It's like, why am I asking about this and we don't have a solution? We want to give a solution. So anyway, we really fit ourselves to these practices in that way, and just say, okay, we spend a lot of time, and we're just, it's an ongoing journey. We're just trying to build those sort of things, or make sure those things are built, or how we can contribute. So a clinician can say, look, and what we're asking them to do is just do an assessment in these core buckets, right? Just at least ask about these things, record it, or have the person in your, whether it's a parent or the individual, while they're in the waiting room in an iPad. This is going on in Memphis right now in 2 places, just so you know, and say, look, just record it and it beams over to us, and we've got some care coordinators and health navigators that'll see if we can get what they need. That's how we're working currently.
I think you raise a really important point, though, that it's not, a lot of examples were lifted up about where we can come to the table, but it's not enough for us just to convene. It's important for us to be thinking about what we're doing at that table and how are we ensuring that we're serving the people who could most benefit from these interventions, but also how do we ensure that they're at the table with us shaping the work. And I want to pivot to, I know in one of the opening panels, I think it was the one on embracing changing tides, I'm probably getting the title wrong, but Sarah Cantor talked about the curb cut effect and the idea that when we design laws and policies and programs for people who are the most vulnerable, such as the disabled or persons of color who have been in communities that have suffered from decades of structural racism and disinvestment. But when we design our policies and our interventions to target those individuals, then we end up benefiting more people. And so I'm wondering, and Dr. Young, I'm going to start with you, how can we make sure that when we're coming together at these tables and we're thinking about interventions, that we're really centering equity in our work and being intentional about having an explicit focus on equity?
We deserve to have those who are going to be affected by whatever policies we try to deploy at the table with us at the very beginning. And that can be very difficult because there's a perceived difference in power dynamics when we invite community citizens into the room with decision makers at the government level, at philanthropy, any of the sectors. And so being able to approach those relationships from a position of mutual respect and non-judgment, critically important. We have a difference in language that we use, making sure that our language is clear and appropriate. We get used to speaking in jargon, depending on our particular discipline, and we fail to understand that that doesn't adequately communicate. We deserve to be more mindful of our body language so that we don't communicate an unintended message. There's so many different ways. I think Terry Bappoon talked about in an earlier session about the misalignment of incentives. If we work backwards to what we really keep the end in mind and really get clear on what we're trying to achieve, and then walk it through backwards to see what the collateral consequences of certain implementation strategies and decisions might be, we're going to get to a better solution so that a policy that may sound good isn't misaligned. And also because we're trying to, as you know, BlueCross and BlueShield, even though they might be accepting prescriptions for social needs, well, they have to make a living too, right? They are a business that has to produce some revenue, or there's no, as the expression goes, no margin, no mission. So it is really critical to figure out that balance in a way that's respectful to all at the table and keeps a viable industry to support everyone. And that's probably, one of the more challenging things. But if we think about what Dr. Raymer said about the legacy of how policies were constructed, we're collecting data from policies that were constructed not based on equity. The reason that we have some of the housing issues we're addressing today is because those policies were structured in the way that they are. And once we legislate it, that's how the money and the resources follow. So we continue to support inequity by supporting those policies until we deconstruct all of them.
Yep, we are still, it's interesting, we are still suffering from the legacies of bad racist zoning policy, redlining, decisions about what gets financed and for who and who it doesn't. And even, that's looking back in our history, but like you said, when we're not intentional, there are policies coming up every day. If we were to take a look at current zoning codes in municipal governments and how they continue to perpetuate neighborhood segregation and a lack of affordable housing. Paul, I want to go to you next because I'm curious what Memphis might be doing in this space to either A, shift the table so that those who have often been seen as not having any power are actually having power in the decisions around, policies that impact their lives, or B, what you guys are doing to address some of the legacies of these bad policies that, continue to perpetuate health inequities.
Well, I can speak to it from just a land use perspective. Over the past 3 years, we went through the process to redo a comprehensive plan, and it was our first comprehensive plan in 40 years. I think the last one was 1981 was the last comprehensive plan that we had, and we actually achieved what we set out in that comprehensive plan. Back in 81, we said we want to be larger, we want to be a bigger city. And so we grew our footprint by over 100 square miles. But what we didn't bank on is that when we grew that footprint, that we would take the people that live in the core of the city and they would just move further out to the new subdivisions that were being built. The impact that had was that the residents that were left behind were the ones that did not have the means to move. The businesses moved with them. The schools began to see a decline in quality and participation, population. And so we saw the negative impacts in the core of our communities. And most of those communities are African-American communities in the core of our city. And so with our most recent comprehensive plan, the whole focus is to build up and not out. How can we build up density and grow our core so that we bring more economic opportunities? How can we improve the quality of housing in our core and make these places is not only aesthetically pleasing, but economically vibrant so that you can now have a more holistic neighborhood and community where residents can thrive, where it's not just poor neighborhoods and rich neighborhoods, but you have economically diverse neighborhoods where you have housing of all types, quality housing of all types. So that has been a focus of the city over the last 5 years to execute the drafting of the plan, which included comments from over 15,000 people and input from over 15,000 people. And now we're on to the implementation side. We finished the plan in 2019, and I mentioned Accelerate Memphis earlier, but it's a $200 million investment into the quality of life in the core of our community and the implementation of the Memphis 3.0 comprehensive plan. I think oftentimes I think we understate how important that is. Developers want to know what are the priorities of the city. And I think it's important if we're thinking about equity that we as a city make a commanding statement as to how we want to grow, where we want developers to make that investment, and what areas of the community are we interested in co-investing with developers. And in some instances, we're going in before the development community to make the improvements that we want to see in our neighborhoods in anticipation of them coming behind us. And the people that have lived in these communities during the down years, our goal is for them to be able to live in those communities during the up years. And that includes improving the existing housing stock.
Paul, it's really interesting to hear about the ways in which Memphis is thinking about its future growth and development. And I imagine, given that this is a statewide summit, that's not just unique to Memphis, but there are lots of other communities in Tennessee and others that are listening that are thinking about these questions. And so I'd like to open it up. Any one of you can start, but I'm curious, as we think about our localities and these decisions about how do we grow, where do we go from here, how do we improve quality of life, what ideas do you have for how we get more seniors at the table and being a part of those decisions so that they're informing the policies that shape whether or not they're going to be able to age in place? And I realize it's on Zoom, so maybe I can't just open it up to everybody. So Jeremy, why don't I start with you, and then we'll just jump in that way.
I think you're right. I know the conversations are happening across the state. We've been participating in a lot of those. Right now, I'm on the National Mayor's Affordable Housing Task Force, which is going after a lot of the same or similar questions. Every locale has got a little bit of a different challenge, but it is still the same conversations. How do we make this a place we want to live? How do we make it a place where everybody can afford to live, no matter their means? Because you need to have that diversity of community and culture in order to have a vibrant and engaging place to live. I think probably one of the things that I see most often is the lack of, like Paul said, a vision. A lot of them will say, well, we want to be the #1 destination, or we want to be, we want to have attract an industry. And I've seen it a couple of times in Tennessee where they got the industry and then they looked around and said, we don't have any housing for those people, assuming that they build that thing that they want to build here. We don't have enough place for the workers to live. There's nowhere for the managers to live. There's nowhere for the executives to live. So they're going to spread out and go wherever they can, but they're not going to live here where the jobs are. And that's a real challenge for everybody. I think just making sure that housing is part of that conversation at the front end, and is part of every conversation, I think is important. And it's one of the big challenges we have, because it doesn't always rise to the #1 priority, but it should be in every conversation. And I'm sorry, because I don't think I answered the question, but I went off somewhere else.
No, but you raised a lot of good points. And so I'm going to ask Dr. Young to chime in next. How do we get more seniors at the table for some of these big conversations?
Well, I want to first preface this with, be careful what you ask for. The boomers have hit the age wave tsunami, so you're about to get overrun. And boomers have historically not been known for biting their tongues. So, the thing that I think we need to be careful about, and we deserve to be careful about, is we want to make sure that the seniors that are the most vocal or the most heard are not the ones that are the best resourced. So in order to be inclusive of all senior voices, working with the agencies who serve seniors and having the opportunity to appreciate their experiences through different lenses is really important. Having little coffees, town hall meetings, allowing people to voice their feelings in ways that may not be traditional for those who might have some impairments, like difficulty hearing or vision issues, making sure that those accommodations are available so we don't exclude any part of the population. Those who might be affected in a different way and communicate using non-traditional methods, addressing seniors who may even be undocumented citizens in our community, who are, undocumented residents in our community, who are here and taking care of younger children, finding a way to communicate with them. But it has to really be intentional. And in a way that we can, like, for example, in Memphis, we have a large Hispanic community. Well, they use La Prensa Latina as their newspaper. There's a way of connecting with those neighborhood individuals to find different ways of getting the information that would be useful. And then I think we need to manage expectations. We should never go out to a group of individuals and say, what may we do? Or what is your opinion about this? And then totally ignore what they say. I mean, if for some reason we cannot follow through on a very solid recommendation, then we're going to have to explain. We're going to have to be willing to explain why we said no. But that's going to be so important going forward. We can throw data at everybody. We already know that logic does not. Otherwise, we wouldn't have the problems that we have, because the data is clear. But people make decisions based on things other than data. So we'll have to figure out a way to communicate with better emotional intelligence. That's something we all deserve to work with.
No, I think that feedback loop that you bring up is so important. I mean, I'm thinking I'm not in Tennessee. I'm situated in Alexandria, Virginia. And just in conversations I've been having with my neighbors and reading the paper and following just some of the dialogues happening here, a lot of people don't feel heard. They feel like they've come to these meetings, they've given their feedback, and then they have no idea where that feedback has gone. and then a decision comes out 6-7 months later, and it's kind of like, how did we get here? And so really figuring out how we can be transparent about how decisions are being made, where input is going, and how input's being acted on in all of our programs, I think is so important. I also wanted to pick up on something you said at the end around finding different ways of kind of explaining why we do this work, and that data is not enough. I wonder if you could speak to a little bit about, in the earlier panels, there was some discussion around storytelling and the story behind the data. How have you seen that be helpful in advancing health and housing interventions?
Stories are very powerful, particularly in case studies and in examples, so that people can almost feel like they have the lived experience, or if they have a reference point to maybe someone in their life that may have the same experience as that person in the case study. But one of the speakers talked about, and I thought it was such a good point. I'm not able to recall that person's name right this moment, but he said it was a sliver of experience based on geography. So I think we do have to be careful in listening to the stories when we hear the stories that may be geographically unique. You know, for example, in Memphis, we would not be able to relate as easily to someone having in the middle of a blizzard, right? And some of the challenges that would come along with that. So that's important. I also think that Dr. T was so masterful in talking about the limitations of certain types of stories, because, you know, she said, you know, do you really want people, do you want to tell a story that makes somebody pity someone? Are you really asking for charity, or are you wanting to tell a larger story about why things are important and to connect to the universal we? So stories are critically important. Having the right stories told the right way with respect to everyone involved in the story is critical.
And I know later on, I think Dwayne is going to actually share a video that tells a little bit of the story of the work that Memphis Habitat has been able to lead. Dr. Huffman, I'd like to bring you in just to see if you have any comments on this particular thread of discussion about stories and the story behind the data.
Well, I could never enhance what Dr. Young just said, but except as we often do in the Deep South, say amen to that. I would just say that that's true. I've made so many mistakes in this regard, so I'm still learning. I will tell a funny story though, maybe it'll be helpful, that when talking to people of wealth that aren't of color in particular, you know, about what's going on in certain neighborhoods, say in Chattanooga and other places that I visit, you know, it's really interesting. You know, I just tell them, you know, you're gonna, if you ever come down, if you ever just be willing to come down there with me, you're gonna find out these are some amazing people who live there. You think they're all like this or that, and I won't go into that because I know what they're thinking and they don't disagree with me. But if you want to go from Lookout Mountain down to the city and core in Chattanooga, particularly in East Side or South Side, you know, it is, get ready. And I'll say this too, and just for kicks today, but when I was the Chief Medical Officer of Erlanger Health System in Chattanooga, and I went down to try to go to the neighborhood meetings in those areas and ask them how we can improve care through our federally qualified health centers. I got cussed out a lot the first time or two that I went to the meeting, but I tell my friends on Lookout Mountain, some of those people are my best friends now. They've got my back. I mean, those people I trust with my life. So that's what you're missing.
No, trust is a, oh, go ahead, Jeremy.
I think travel is broadening. I think that's one of the things that most people, if they don't have the opportunity to meet other people outside of their certain cliques or communities, they're missing out on the vibrancy that the rest of the community can bring. I went to a small college in Kentucky, Berea, which was dedicated to bringing together people of low incomes, Appalachians, Black and white, and giving them an opportunity. And what I saw from that was all of us came from very similar circumstances. It didn't matter if we were living, up in the front, up at the top of the Appalachians, or we were living down in in Georgia. The experiences of being poor were the same. And you met good people just like you would in any other class or stratification of people. But being able to meet them as human beings and acknowledge their existence made it a lot more real when you started talking about policy. That you're not making assumptions of who this policy is meant to help or what it's supposed to do, but you've got a visual of who those people really are. And like I said, travel is important, and I think everybody should go visit more than just their local neighborhood to get a sense of what their community is.
Paul, I'm going to come to you next, but before I do, I just want to invite folks, if you have questions, please put them in the chat, and we're going to go ahead and bring some audience questions here. But Paul, I'm curious if you could speak to, give us an example of what this looks like on the ground and the ways in which your department goes out into community and partners with community to better understand what residents are experiencing related to health and housing, and maybe how you've had to shift or what you're doing differently in light of COVID.
Yeah, so we're out in the communities often, and a lot of times we're either working with partners like Habitat who are working directly with residents. Our agency rarely does the work directly. However, with our weatherization and lead programs, we actually do have staff that actually go into the homes of these families. It's been challenging over the last couple of months. Obviously, with COVID going on, we have not been going into units, and so we have a lot of families that are really, really struggling right now with the housing conditions that they're living in. And so we certainly are hearing from them, and we're working on some mechanisms to allow us to get into those units. However, they're hurting. People are hurting right now. And, one of the calls that I get most often from the mayor's office is some elderly resident that is struggling with the conditions of their home, and they want some help. And so it's really challenging. We know that the need is there, and we know that even with the limited resources we have available and the partners that have been working tirelessly at this work, we still need more. And so, as we continue this work, we just can't impress upon people enough that we have to do a couple of things. One, money is always at the core, but also capacity is at the core. We need to have more qualified tradesmen that can actually go into the homes and do some of these renovations. The people that are actually doing the work, construction firms, that's a whole nother side of the equation that we also must build up in tandem with adding the additional resources for the work.
Paul, you mentioned in the short term, you guys are thinking about and experimenting with different mechanisms you can do in order to respond to some of these immediate challenges. It looks like Dwayne just mentioned that they're getting these calls as well. Can you just maybe share an example of some of the things you guys are thinking about?
Yeah, so one that we're thinking about is, one of the challenges is with weatherization and lead programs, there are income requirements. And so you may have a resident that earns $5 more than the 80% of the area median income that our programs can serve. And given their debt capacity, their need is just as high, and their availability to pay the bill may not be, it's just as hard as the folks that are just below that threshold. So we're identifying some programs where we can help families with higher incomes. We're even looking at some 0% loan programs in partnership with some agencies. And so those things will add just another quiver another arrow in our quiver, rather, that'll allow us to be able to help people that are in need. I mentioned earlier that we have $7.5 million that'll go towards affordable housing. We're still working through how that will actually break out, but we do believe that we will dedicate a portion of that solely for home repair. And as we do those home repairs, it will address many of the seniors that are in need. So, just thinking through creative ways that we can allocate the limited funds that we do have, and also thinking about other innovative ways like through, I don't want to go too deep, but getting into the community development block grant program. They have what they call neighborhood stabilization areas, which when you designate an area as a neighborhood stabilization area, you can then use CDBG funds in a more flexible way. And so as we identify where those areas will be, trying to think through whether we can apply more funds for programs like this, where we can add some CDBG to help some seniors in those areas. So those are just a few of the ideas that we are actively working on. And our hope is that, by this summer, we'll be able to roll some of those things out.
Thank you. Jeremy, one of the questions we received is kind of, what does this look like in rural communities? I'm wondering if, similar to the way Paul illuminated some examples in Memphis, if you could share maybe some examples you're seeing from across the state in rural areas.
Absolutely. There's a need for affordable housing in almost every community. And there's been, I would say, with the changes in the economy, some of the rural areas have lost maybe some of their large job producers, the things that brought income into those communities. As that has happened, the population in those have shifted. The people who are there in a rural area are getting older. They're having more health issues. They're staying in their homes because they're all paid for, or perhaps they're on a fixed income, but that's where they live. All of the younger generations have moved further away to jobs, to find work. And what you see is a disinvestment by those people. They don't have any capacity to keep investing in maintaining a home that's too big. There's nobody to buy it so they can relocate to a smaller, more appropriate housing for seniors, so they get stuck in a house that's too big to maintain, too difficult for them to operate. And you see the same sort of traumas where they're trying to cope with a house that's falling down around them, or causes them more problems than they can really deal with. And it's really challenging because there's not a lot of programs, unfortunately, in some of those rural areas to do that. You can drive through almost any small town in Tennessee and see the home that used to be a fabulous home that's on the main street that has fallen into disrepair, and there's nobody buying that home to reinvest in or move into it because there's just nobody there to do that. Which is terrible if you're a home owner that lives nearby, because you can't keep your home up if the home next door is falling down. Again, it's just a vicious cycle. So we see a lot of challenges. They're different kinds of challenges, but there's the same kind of concerns. Lack of healthcare. I think one of the things that troubled me most when I worked for the health department was watching rural health close. Hospitals that close, and suddenly you're talking about a senior who's living maybe 2 hours away from a hospital. If they have a serious medical event, a heart attack, for example, they're much less likely to survive than someone who's living closer to those services. And they can't leave, or they end up leaving and just leaving behind their house, which they can't maintain. So it's a real struggle, and we see a lot of those issues. I haven't seen a lot of good solutions, unfortunately. I think, one of the things, and this is just my personal opinion, universal income is one of those things that I think would help stabilize some of those rural areas. It'll do the same thing in the cities, but that there doesn't seem to be an appetite for that. And I don't know of any way that, like I said, those jobs in those rural areas aren't coming back to the way they were. So you've got to deal with the situations you find now.
Dr. Huffman, I want to come to you next because the rural question actually had two parts. So the second part was, the person was excited to hear about the ways in which the healthcare industry, both health plans and hospitals and others, are coming to the table to be a partner. But in rural communities, they feel that, their institutions are sometimes stretched already really thin. And so how do you suggest, folks reach out to or talk to healthcare partners in order to garner support? It says for sustainable financing for housing and health interventions specifically for seniors.
That's a great question. In the normal course of business, particularly for low-income senior programs, we have essential partnerships with the AAADs, Area Agent of Disability, and they're urban and rural expressions of that. That is a touch point that the more vulnerable a person is, say a senior, that we insure, the more likely they're going to, end up qualifying for some home and community-based services that we also oversee for the state of Tennessee. So that's kind of a touch point. The AAAD, they're regional, they're all over Tennessee, and that's a good touch point. The other encouraging thing I would say of encouragement is the governor and state government has a high priority for the Medicaid population and those who are dually eligible for Medicare and Medicaid in terms of rural distressed counties. So we have a specific focus on rural distressed counties, and I could talk more if anyone's interested, and I'll be glad to be helpful, and ping me directly. I'm sure my email will be provided. If you're interested, we're interested to be as helpful as we can. But I just want you to know that goes down to the current pandemic, and I won't go off on that today. But we're working very hard this week. I mean, very hard, all hours of the night and day with the Department of Health, the Metro Departments of Health, and the Rural Departments of Health, and those are vastly different organizations. We're just trying to figure it out with the TennCare, the state Medicaid agency, the Department of Health, and we're providing them a lot of the data that I mentioned previously. They didn't have. They have great data, but they didn't really kind of know exactly what we know about the most vulnerable members. And so literally, there are people, this is what we do, so that's just an example. So we would be interested in whatever you're interested in rural areas. See what makes sense.
All right, thank you. Well, our time has gone by so quickly. So I'm going to ask a closing question, and then I know I need to turn it back over to Dwayne for closing remarks. But it has been just really powerful to hear each of your insights on these different topics we've covered and the roles that your sector brings, but also how do we navigate some of these challenging issues around centering equity and shifting power and finding ways for sustainable financing. I want to pick up though, Paul, you put in the chat that we should make Tennessee a leader in the movement or a leader in this work. And so my question to each of you, especially as, Memphis Habitat and other affiliates prepares to, have their Hill Day and, really try and deepen this work. My question is, what step are you committed to taking in order to help make Tennessee a leader in this space? And what would you challenge others to do? So what are you going to do and what do you want others to do? And Paul, I'm going to start with you since it was your statement in the chat that inspired this.
Well, I'm committed to committing the resources that we have to support this effort and committed to making myself and our team available to help strategize, to help think through how we can deploy resources in a way that's going to help the residents specifically of the city of Memphis, but advance the narrative for the state of Tennessee. Our hope is that some of the things that we do here in Memphis will be examples for the rest of Tennessee, and hopefully we can learn from the rest of Tennessee. And my hope is that other partners would be willing to do the same.
Great. Thanks, Paul. Jeremy, let's hear from you. Let's hear from you next.
Okay. I will commit to making sure that we're there for every discussion. I've got liaisons in each of the regions and they participate in these groups. If there's meetings, they'll come to them and they'll be sure to be able to tell what resources we can bring to bear to be part of that process. Whatever they're trying to do, we can figure out if there's a program we have that can serve that or can participate in it. At the very least, we'll take back information and look at our programs and go, is there something we should do to change those? That's what I would do. And the challenge I have for others is you have to be involved and you can't just talk to your usual suspects. You've got to talk to fresh partners. You've got to reach out your network to a broader group, because that's the only way you can get a true momentum in things. If you're only talking to the people who only do the things that you do, you will only hear the answers that you already know.
Dr. Young, I'd like to go to you next, and I'm going to amend it a little bit because of a comment in the chat. So the question is, what are you committed to doing, and what might you challenge our leaders in Congress to do to better help health and housing initiatives?
Well, I would love for them to pay attention and stop thinking about their own reelection and doing the right thing. So I would pray that they all have their moral compass on right. But I don't want to get too political. So I am committed to being more intentional in working with people like the Sycamore Institute in Tennessee to look at hollow policies or policies that are not effective, to deconstruct them in a way that we demonstrate that and show that. I'm also committed to exploring different ways of supporting our organizations and our group of organizations to more effectively tell their story, so that even a child who is in kindergarten can say why it's important for grandma and grandpa to live in a great house, and why it's important for all of us. You know, everybody from womb to womb to tomb, everybody understands in the spectrum. And I think the messaging is so important because I worry, we are fortunate that we have Paul and his team who are committed to the work. We're fortunate to have Jeremy. We're fortunate enough to have Dr. Huffman, but state administrations and local administrations change, and priorities tend to change with those administrations. And we deserve to be able to institutionalize within our community those things which are right to do. And perhaps telling the story in a more effective way will mobilize the members of the community to force new administrators and new elected officials to continue the valuable work that's being done now. Because I would hate for the foundation that's been laid to just crumble in the next election.
Well, Dr. Young, you got a lot of amens. So I think that comment really resonated with people. And Dr. Huffman, last but not least, same take as Dr. Young. What will you do, and what might you challenge those in Congress to do?
Well, first of all, I've already had conversations with Dwayne Spencer, leading up to this panel today about my willingness to help, and he and others are going to help me understand how to be helpful. So I would say that. Leaders in Congress, I don't know. I've been to Washington, D.C. one time and spoke to our congressional delegation about something else, and for BlueCross BlueShield only one time. And of course, I got my picture made with everybody I can find, sent it to my mother and my sisters and stuff like that. But I was just expressing willingness that if it's not me, I'll find somebody that can get an opportunity to speak to it. To our congressional leaders.
Great, thank you. Well, I appreciate your time today. Thank you for sharing your insights, your perspectives, and engaging in this conversation. And with that, I'm going to turn it back over to Dwayne to close out our panel, but also to just close out this great summit.
I am so pumped. Thank you, panelists. Thank you, Alyia, for that fantastic conversation. That was amazing. So as I was prepping for the final session, we had a board meeting last week, and I asked my board if I could share some big, audacious vision today. And they said, okay, yes, do it. We're with you. And so what we want to commit to is continuing this work. So over the next 5 years, Memphis Habitat is prepared to provide an additional 1,000 older homeowners with life-changing home repairs. We are going to commit ourselves to raising the estimated $13 million to perform those critical healthy home interventions. We plan to create a multi-sector advisory group so the folks can help us make sure that we're prioritizing our efforts in the right way and adapting a really strong value proposition. We want to work with partners, health plans, as Dr. Huffman said, healthcare systems, real estate developers, municipal systems, philanthropies. We want to make sure that we're collecting the right relevant data. And then we want to analyze it and apply it in a fashion to create really an evidence-based narrative and story. And we're going to advocate, Mary Shearer, my friend up in Kentucky, we're going to advocate. We've long advocated for affordable housing policy, right? But we'll now actively look to promote age-friendly policies at the local, state, and federal levels. So, what I've committed to is Memphis-centric, but I hope that all of my friends who are watching, are thinking about the same sort of commitments from their own communities. So I want to just remind everybody again why this is so important and why this is really our moment to address this together. If where we live can make us sick, and we know it can, this is what we've been talking about for 3 weeks. And right now, in this case, we're talking about our most vulnerable seniors being negatively affected. What are we waiting for? It's time for us to take action. And at Habitat, we already know that low-cost senior home interventions are having a positive impact on a senior's health, right? That's why it's time to increase our momentum, not shrink away from the challenge, but rather embrace the solutions that we can all work on together. So I want to invite you to imagine the future with me. So imagine a future where seniors are empowered to retain their independence. Imagine a future where seniors can remain rooted in their communities because their homes are safe now and free from hazards. Where we, this community, all of us, can help reduce those high medical bills from falls, minimize unnecessary ER visits and hospitalizations, and prevent early entry into nursing homes. We keep preaching that. Where the benefits of our efforts to support seniors creates compounded benefits for the community at large. Where government, philanthropy, healthcare, activists, nonprofits, the faith community, all of us are working together to help our older neighbors be able to live out their lives with dignity in the homes they love. Where seniors can make their own decisions and practice self-determination because we, you and I, have given them that opportunity. I'd like to share that video now that really speaks to the heart of the matter.
My wife's name is Shirley. We've been living here for 30 years, ever since her mother given the house to us when she passed away.
It's been up and down with with the house messing up on everything. We had a lot of problems, couldn't take care of nothing, but we're on a fixed income. I got a chance to go to Habitat and fill out papers and everything, and that started a new beginning for us.
So our goal of the Aging in Place program is to allow the seniors here in Shelby County to live in their homes longer, to look at accessibility, mobility, and safety for the seniors in Memphis.
Our general applicants who come into the program are living on a fixed income. It's hard to save up for something like a new roof or maybe some plumbing issues or new windows when you're living paycheck to paycheck like that.
Then one day, I hear something dripping, and I look, and then when the rainstorm come in, it just poured down. The roof would have fell in, the house would have been gone. We would have been like stranded in life, wondering what we're gonna do now.
So the work that we did at Ernest and Shirley's home, that is a typical job we see. They're having to put pots and pans around the home to capture water that's leaking from the roof, not able to use their kitchens, structural problems, bad electrical problems, lights not working, fixtures not working.
A lot of our applicants have to do the best they can with what they have, and that can cause some issues, obviously, if you don't have a professional working on these things.
I was trying to do what I didn't know how to do, but I had to do something. And I tried, but it didn't work. It didn't work until Habitat came about.
When we first came, we noticed that their roof was original, very old roof, never been replaced.
Habitat had come here and they had fixed the roof, tore everything off and completed it in one day. That's a relief right there. Watching the roof being done and the work being done on the house, I just wanted to cry.
It's like a world that's not there anymore about how we live. because it's like the world had been fixed by Habitat.
We want to respect our seniors, and we want them to age in place with grace and dignity. Sometimes it's a home that's been passed down from generation to generation. It came from grandparents or parents, and it's very much a family heirloom to them, and they certainly don't want to leave that behind.
We've helped hundreds of homeowners here in Shelby County, but there's still thousands out there that need our services, and it goes beyond Shelby County, beyond the city, and it goes statewide. This is grandparents, this is mothers, this is fathers out there that need our services.
It kept us from having to try to move out and find somewhere which we couldn't do that, and HCP made an effort to help us.
Thank God for you all. God love y'all and we do too, because we couldn't see how in the world we could have got it done without y'all helping us. Habitat is beautiful. It's beautiful.
I don't know what more I can say after that powerful video. Ernest and Shirley. As my colleague Laura Anderson said, we want to help our seniors age gracefully in place. Older seniors need our help. We know what to do. Let's find a way to do it together. I want to thank all of you for joining us on this journey, the Tennessee Health and Housing Summit. It's been a labor of love and a real pleasure being with all of you these last few weeks. I truly hope the summit has been as beneficial and inspiring for all of you as it has been for me. Videos from this week's session will be available on our website, and in a few weeks, we'll share an executive summary and highlight key takeaways from the summit. Finally, I want to offer a special bit of gratitude to our amazing team here at Memphis Habitat, and to our consultants who have worked for nearly a year and a half to help bring this summit together. They've spent countless hours researching and then interviewing the panelists, prepping the panelists, managing technology, registrations, artwork, traversing a pandemic. This was going to be a live event at one time, and helping me formulate all the right words to say. And I know that's a big challenge. So thank you to our team. Thank you to all of you. And thank you for being with us. I hope you will have a wonderful rest of the week. Take care.